Travel has been very clear, and I think the government has been very clear on that advice, which is to avoid non-essential travel for now. Yes, there's a small number of places globally that is in a similar position to ourselves in relation to the disease. But you can't be sure in going to any country at this point about how the situation there will evolve. And again, I mean, ultimately this is individual choice. We can only give advice, we can only give guidance. But I mean, we have been clear that in our view, and it's from a public health perspective, and we understand the importance of summer holidays, we understand the importance of family holidays, but we're appealing to people for this year to consider staying at home and to consider going on holidays here in Ireland, where we have a full understanding of the disease and we have a full understanding of how our businesses and hotels and other premises are doing their best to ensure that you're safe when you're on your holidays.
No new deaths again today. That's 2 days in a row. It's been quite some time since we've had 2 days like that where there's been no additional deaths. It must give you some sort of comfort, I suppose, to be able to report news like that.
Of course. I mean, the most difficult aspect of this, obviously, throughout the process has been reporting the deaths and being aware of the effect this has had on families across the country. So it's brilliant that we've had 2 days, but we always caution, I guess, early in the week that there's a weekend effect, and sometimes cases aren't notified as quickly at the weekend in terms of deaths as they would be through the week. So it's always a positive, but as always we continue just to monitor it over the week. But I would say that obviously the trend has been down and down in relation to deaths, and hopefully that will continue.
Rob O'Hanrahan and Joe Dudley. Dr. Henry, I think this might be for you. Just on the cervical screening, which I understand resumed today, can I ask about specific plans that are there then to clear the backlog, considering they've been suspended now for the guts of almost 4 months?
Yeah, well, obviously we're really delighted to be able to start the cervical screen programme again. And as I've said before, when these services and others were suspended in March, switching the light switch off was quite easy. Switching them back on again in a new COVID environment is much more challenging. What we've had to do is look at each of those screening programmes and look at each step in the pathway and see how the COVID environment impacted on that step. And because we want to make sure we're bringing healthy people in, which is what screening programmes do, that we make them feel safe and protected when they come into a screening environment. We also have to make sure we have capacity so that each element of the pathway would lead to, depending on how the screening result comes out, that would lead to demand somewhere else in the service. So with cervical screening programme, as people who should know if they don't know already, is we're starting with a new programme, the HPV screening programme, which is more effective as a screening tool. It's still not 100%, but it detects for every 1,000 people screened, there are 20 that show precancerous changes. The previous method, which was cytology, picked up 15 of the 20. This picks up 18. So it is more effective. And that's the mode of screening. For people who are availing of the screening service, they'll notice no difference. But we'll be starting with priority groups. That is to say, people who are on 1 year recall that were due to come back for reasons pertaining to their previous result. And also for people who are new to the screening programme, because they have a additional slight risk because we don't have any previous records on them as we do for other people. But direct answer to your question, what we will do is for those cases that were suspended as a result of COVID, we will have cleared those by October, and then for any further cases, as we work our way through those that are, if you like, delayed, we will have caught up by them by February of next year. That's to say, any cases that are delayed in 2020 as a result of us catching up, if you like, with those suspended from the time that the cervical screen was suspended in March until now.
Can I ask, I was looking at the HSE website, and in terms of changes that people may notice when they go for these appointments, stuff like talking with your doctor on the phone before your appointment, your doctor or your nurse wearing PPE, being asked to wear a mask, being asked to wait outside, they're all quite basic. And my question there is, why did it take so long for these to be implemented? Because they're very, very similar to, for example, what you might do if you're going in to get your haircut and that returned last week. Or say, for example, if you're going in to go for a bar or you're going for some food, and in terms of the contact that's there and the length of time that you're there as well. The changes don't seem that difficult to implement.
There's more to that, to a screening programme. For a breast screening programme, for example, which there's the people coming to a congregated setting, there's referral onwards to diagnostic facilities, referral onwards to breast surgery facilities, all of which are operating in a COVID environment. For bowel screen, as people will know who are availed of this particular screening programme, it's access to colonoscopy. That's now in a new normal. It's not rapid throughput colonoscopy that we used to have. It's now donning and doffing of PPE. It's now cleaning the room in between people. So our capacity in colonoscopy has gone down by upwards of 50%. So in the case of cervical screen, the screening test per se is performed in primary care, but there are other steps to the pathway, including colposcopy clinics. There were other issues during the pandemic which involved redeployment of staff from different screening programs who are now back in the screening programs. So as I said earlier, switching these things off is quite easy. Switching on again, not so easy.
And finally, just in terms of switching back on, some countries in Europe, like notably Germany, Hungary and Sweden, have reported lower uptake in these screening services since they've returned. Is that a concern here, and is there anything in place to try and combat that in advance?
Yes, it is a concern. Can I bring up a bigger concern? I will get to your question. Is what was as big, if not a bigger concern for us during this whole 17 or so weeks now, is that people who had symptoms. Now remember, screening programs are for healthy people. They're brought in from their homes, from the streets, from their places of work to avail of a screening test, which may detect an abnormality, and then proceed to further investigation. But we found that people attending our own rapid access clinics for people who have symptoms suggestive of cancer, there was a big drop-off. So I would say to people, first of all, please, if you have symptoms suggestive of cervical cancer or suggestive of breast cancer, any other cancer, don't wait for a screening program to give you an invitation. Go to your general practitioner with those symptoms, because you belong in a different group. Your questions won't be answered in the screening program. As regards the uptake, significant element of the success of every population-based screening program is that a critical proportion of the population take part. And that's why we want to make sure, as we reintroduce these services in a phased and incremental way, that people feel safe and protected, so they know they're going to a healthcare environment where there's a very negligible risk of them contracting or indeed passing on COVID-19.
Sorry, Dr. Ling, can I just clarify just on the at-risk figures? There were no further hospitalisations or deaths in those categories either?
I'll follow up with that with you afterwards. I don't have it to hand, but we do have that information, so we'll make sure you get it tonight.
Thank you.
Hi, Dr. Glynn. Sean Murray from the Journal.ie. Just we've seen internationally that countries have begun to reopen. In some areas we've seen a rise in cases. So I was wondering, what kind of modelling have we done here in terms of, as we open up, as other countries have, what kind of increase in cases we might have, and do we have a criteria for what would be deemed as an acceptable rise in terms of new cases or hospital admissions?
So obviously Professor Philip Nolan comes in every Thursday and he can provide more information on the specifics of the modelling. But I think if I'm correct, your question is more about what are the key indicators that we're watching. And I guess if I bring people right back to February, we used to get the question all the time about what will move us from one phase to another. And our answer then, and it's still the same now, is that there won't ever be one indicator. So I've given tonight the 14-day incidence, so the number of cases effectively in the last 14 days, and we look at that very closely rather than looking at the total cases or the total deaths over the entire period. Increasingly now we're going to be looking at that incidence by region and making sure that as a country things are staying stable. We'll obviously look at the reproductive number, and then crucially we're particularly interested in new hospitalisations and new admissions to ICU. And if we see those moving in the wrong direction and moving quickly in the wrong direction, obviously that's a clear sign that we'll need to act quickly.
And are there numbers in mind? Like if we start to see maybe 20 cases a day or 30 cases a day, would that still, on all those other indicators, would that still be acceptable for yourself?
It's very difficult to say. So for example, today, or in the last number of weeks now, we've had hospitalisation and new admissions to hospital in single figures. So if we were to look at the data today and see that there was 20 additional hospitalisations, that would be a very significant cause for concern. If we had 150 people in hospital and we saw another 10 or 20, obviously that would be cause of concern for a different reason. So it's not just about the numbers, it's about the speed with which the numbers are changing and the speed with which they're changing relative to the baseline that we're comparing them against.
And there's nothing to give you disquiet at this stage from the numbers that we're seeing?
No, at present, things are very good, but obviously we need to we look at that data every single day to make sure that if things change at all, that we can pick it up and act on it.
And just in terms of private hospitals, there's been a lot of commentary around that some private patients, to go back to get treatment in private hospitals, they're paying up to 250, 275 euro for what's called like a COVID test before they can get their treatment. And it's not at present it's not covered by the insurers. And there's a lot of criticism around private hospitals for doing that. What's your reaction to that? Because they said that they're doing this in line with guidance issued by NEFIT. So can you expand on that guidance? And do you think it's acceptable that patients will be paying that much for a test before they get their treatment?
So I don't think it's acceptable that anyone should be precluded from important treatment because they can't pay for a COVID test in the context of a global pandemic. So I'm not going to get into the specifics, but we have very significant testing capacity in the country. We have reiterated for months the importance of testing in the context of controlling this disease. If this disease gets out of control, it will have very significant implications for all facilities, public and private. And so in short, I don't think anyone should be precluded treatment because they can't afford to pay for a COVID test.
In terms of the guidance issued from NEFIT then, was that a very clear thing for if people before they go in for their treatment that they should be tested to see if they have any symptoms or if they have COVID? Was that part of the guidance?
Yeah, there was interim guidance given with our own system for people so people coming in for scheduled surgery. Our advice is that they would cocoon or self-quarantine for 14 days before and then get a test 48 hours or now 72 hours before they come in, just to make sure that they minimise the risk of them introducing COVID into a healthcare environment. So that is the interim guidance we have given out to patients undergoing scheduled surgery in HSE.
Brilliant. Cheers, guys. Thanks.
Hi, Ciara Phelan from the Irish Daily Mirror. Dr. Glenn, you voiced your concerns over the scenes that we've witnessed on Dame Lane and across the country elsewhere of pub goers out and a lack of social distancing. This morning, Taoiseach Micheál Martin also said he was worried in an interview after the videos and images. I was just wondering now, are you considering delaying the reopening of the planned, the remainder pubs towards the end of this month?
So, as I said, we look at the data every day, and all of that data feeds into the recommendations that NEFIT makes at a point in time. So, we're a number of days away from our next set of recommendations. And clearly, first and foremost, we look at the disease and we'll make recommendations based on the disease. But in short, yes, we're keeping everything under review, and we'll just have to see how things go over the coming week or two.
Okay, thanks.
Apologies. I was just interested, actually, you mentioned the number of cases in Sligo, which I think went a month without any cases, and now had, 18 cases. Are they all related to that travel cluster we were talking about last week?
The majority, at least, are related to the travel cluster, yeah.
Yeah, well. Can I ask you in relation to the green list, if a green list isn't the right thing to do this week, is it going to be the right thing to do on the 20th of July? What's going to change? I mean, given the trends that we know about internationally.
So I think what's changed from our perspective over the past week or two is that things have become more volatile internationally. Now, there's good reasons for that in many instances. So if you look at Germany, there was the big cluster in the meat processing facility. So in short, it just gives us another couple of weeks to see what happens and to see if countries, I guess, no more than ourselves, it won't be unexpected if we have larger clusters and some issues at points in time as we move forward. The test is whether we can control those clusters and outbreaks quickly. So a number of countries recently have had problems, and this gives us a little bit more time to see if they're able to get on top of those problems and close them down. And ultimately, what we're adhering to is what we had said all along, which is that we'd avoid non-essential travel to the 20th of July, and then we'd see what we could do after that. And clearly there are a number of countries that do have a similar profile to ourselves, and which we feel would be safe to travel to.
But as you know, the next month's figures for cases are being decided on the streets of Temple Lane today, and the figures for deaths in 2 months, let's say, are being decided by what happens. So the trends are already in train, aren't they?
Yeah.
So with your public health doctor hat on, you know that not a lot is really going to change really by the 20th of July. And perhaps it might be clearer, but say no green list this week and no green list on the 20th of July. That should be your advice.
It may be.
But, you know, that leaves people up in the air. Is it fair to people to leave this grey?
Very little about this pandemic is fair, Paul. It's not fair that people can't go abroad in their summer holidays. It's not fair that people can't go to the pub and have a few pints with their friends like they normally do. Our job is to give the public health advice based on our assessment of risk. In relation to travel, we believe there will be a list of countries, and that list will change over time. And even if you go abroad to a country that's on that green list, I mean, everybody who does that will have to do so, and the understanding that by the time they could come back, that country could be on, you know, not on the green list. And again, they'll, in that situation, they'll be asked to restrict their movements for 14 days.
But then, to turn the question on its head, then why not have a green list this week, but a very restrictive experimental one?
Because the global situation is changing very rapidly in the last week or two. Last week we had 160,000 cases daily. We had 200,000 cases a day over the weekend. We need to see where this goes. The situation globally could get worse over the next week or two, in which case, you know, we'll have to think again about who is or is not on the green list.
Okay, and just finally, over 60 people have died in hospital having contracted the virus there. Is there any plan to investigate why this is so and whether anything could have been done to reduce the figure?
I think there is always an intention to do better and to learn, but we are talking about a very, very infectious disease and a very infectious virus, and whilst it's not acceptable for one person to get a hospital-acquired infection, the reality is that infectious diseases are transmissible, and despite the best efforts, and particularly despite the best efforts in the context of a pandemic and all of the pressure that our healthcare staff are under, there will always be cases. And, you know, again, like many aspects of this pandemic, we'll only really be able to assess our performance versus other countries in time. So yes, I think we need to continue to learn and to do better, but I think that's part of reopening the services and ensuring we're doing it in as safe as way possible. And I know the HC has been working very diligently on that over the past number of weeks to ensure that all services reopen in as safe as way as possible over the coming weeks.
Okay, thanks. Thank you.